Okay, guys, we are going to talk today about pharmacological and chemical ergogenic aids. Um, I am Brandon Roberts, and you guys should hopefully remember me from the ketone lecture. I wanted to just make an attempt at this lecture, recording it so you could watch it later. I'm actually in the middle of grading y'all's tests right now, so should get those back to you pretty soon. But if you have any questions, there's a slide at the end with contact information. Um, or if you see me in class, you can always just ask for an email or something like that. But let's dive in. So, pharmacological aids are basically used in every sport imaginable. And they're not just used in sports, they're also used in academics or everyday life or businesses, right? So when we think pharmacological aids, we usually think steroids. I think that's what most people tend to gravitate towards. But we also have kind of cognitive pharmacological aids, and this is a whole new area of focus now, especially for students and people who work in Silicon Valley and things like that. Um, and I'll speak a little bit about that later, but I want to start out with the more traditional pharmacological aids and just what they can do. So these are all images of athletes who have been either banned for PEDs or PEDs are just part of their sport. Um, and I'll say PEDs just because that's going to cover most of the pharmacological things. Um, and so in the top left, you can see here that's IFBB, top bodybuilder probably in the world. But that's also part of their sport is they take a lot of aids. Next to it on the right, you have Mark McGuire, home run hitter, right? He got popped for steroids in the Balco era. You have, I think it was Michael Johnson, the sprinter, who got popped after winning numerous gold medals and lots of world titles. So those were all stripped. You have a couple fighters. So I think this is Roy Jones Jr., who has been popped for drugs. Then probably, the most famous pharmacological aid sport athlete is Lance Armstrong, of course. 6 Tour de France titles, all of them pretty much gone. Lost millions, maybe hundreds of millions of dollars over his lifetime afterwards. And then Marion Jones, I'm pretty sure that's Marion Jones, also got popped for drugs and lost a lot of world titles and gold medals. So you have a assignment in your in this class. Part of the class is picking an ergogenic aid, and I put a ton of them on here. Some of them are pharmacological, some of them are basically supplements. The one that I am going to talk the most about today is going to be anabolic steroids. But again, you can find these across all sports, all domains. But I want you to kind of pause, and you can pause the video, or you can pull up a notepad or something, and just either, if you have one in mind, go ahead and write it down and write why you want to write about it as part of your grade for the class. But then we'll circle back, and I'm interested to see how your ideas develop over the course of a lecture and then over the course of your research. So just because you pick an aid doesn't mean you have to stick with it, right? You could only do one, but if you start looking and you're like, I'm actually not that interested in this. I really want to focus on the cognitive side, which in this lecture, again, I won't really cover much of. So I want to go that route instead of the traditional, maybe caffeine or anabolic steroid route. Okay. So take a moment and do that. Just pause the video, and then when you're done, click play. And I wanted to take a slightly different approach to these aids, and that's things we want to consider from a a scientific perspective. So hopefully, when you kind of pick your aid, you'll be looking at studies, and a lot of these have been studied but just to walk you through the steps of a paper, basically. As you're doing your research, you have justification. So why do they do it? Do they think that anecdotally or maybe observationally there's been connection between people who do really well at something and this drug or supplement? So that could be scientific rationale. Could be that, hey, we know this drug affects this pathway, and this pathway is really important for muscle growth or muscle endurance or lung capacity or something like that. So why are they doing it? Then we want to look at the subjects, right? So we have animals or humans. Animals are probably going to be mice or rats. And then humans are humans, of course. Sex. So there's a big deal about having data in both sexes now. So you see a lot of all-male studies, and especially when you get into ergogenic aids, they may not all translate the exact same. Perfect example is anabolic steroids. They affect men and women very differently. Training status, are we using this on people who've never been to the gym or on a track? Or are we using this on elite athletes? And then, of course, nutrition to go along with that, and health status. So, health status is more like, okay, well, maybe it doesn't help recreational athletes or people who like to work out, but maybe it helps people with type 2 diabetes or people who are overweight or people who are losing some adaptation because of a disease. And we'll get into an example of that later. So the research design, the gold standard is a randomized controlled trial. Double-blind is best, placebo-controlled. You want to basically not have anything that can interrupt your interpretation of your data. So if your subjects pick their groups, for example, that's bad. There's some bias there. If your subjects know they're taking something, that can also bias them. They're like, oh, I know this drug is supposed to make me bigger, faster, stronger. I got the drug, I'm going to get bigger, faster, stronger. So there's a lot of psychological components to a ton of different drugs. And then measurement, are they taking a measurement that matters, or are they saying it affects strength, but actually they're measuring endurance? And you seldom see those type of things published, because in review those will get caught. Conclusions. Are they saying what they found, and are they extrapolating too much? Is there appropriate statistics? Statistics is a whole nother world. I don't expect you guys to really get into that much, but it is very important. And then the physiological relevance versus statistical relevance, right? So if I have a statistical effect on an ergogenic aid and it's 1% and it's significant, right? So there's a 1% advantage for taking this ergogenic aid, but the aid cost $200 a dose. Well, unless I'm at the very top of my game or really rich, I'm probably not going to practically use that supplement or that aid. So we have to always weigh those things. And then dissemination of findings for your assignment, obviously it'll be peer reviewed. And hopefully, as you go through the peer reviewed research, you realize, or you'll see, that people repeat parts of studies to make sure they are reproducible. So the big thing in science, rigor and reproducibility. If someone else, or not more than one person generally, if a group of people cannot reproduce your results, they become very questionable and the data becomes very skeptical. So ergogenic aids, here's a nice definition, but it started with the Romans and the Greeks, and they ate raw meat. Sounds pretty disgusting. Later in the first Olympics, they had athletes eating sheep's testicles. Also sounds disgusting. In the mid 80s, we had cocaine, which was in Coca-Cola, and Americans were consuming it. took that out shortly thereafter, once they figured out what it was doing. But 50s were the steroid era. 70s, people love to eat raw foods, apparently. And ergogenic is broad enough to be foods, supplements, drugs. So you have the high carb movement there too. And in the 90s, IGF and growth hormone, I think that was big in like baseball. So you can see most of these things have evolved, but they're similar similar frames. So how do we think they work? Well, we have stimulants, so that can increase your level of output or bring you up if you're down, like caffeine. You can increase the substrate, so let's say if you somehow figured out a way to increase glycogen or take a supplement that increases creatine, which you could totally do. You can reduce metabolic byproducts, right? So as you build up lactic or lactate in cycling or in endurance sport, maybe there's a aid that helps you clear it faster, so you don't hit your threshold as quickly. You could have an ergogenic aid that helps recovery, so branched chain amino acids were really thought to do that, and have been shown a little bit. And then you also have supplemental fuel sources, which are ergogenic aids. You see people on long endurance races eating gels or whatnot. Those are indeed ergogenic aids. So it's a very broad topic. And to get into anabolic steroids, I think first they are used to treat muscle wasting. So there's a pro to them, and osteoporosis and lots of other diseases. But a lot of athletes figured out that you could use these drugs to build muscle. So anabolic steroids are very broad. So you have over here on the left, you have testosterone, right? So that's in your body. And you'll notice how these other different compounds are very similar, right? These are two big ones, stanozolol and nandrolone, big in the strength and physique community. I've never really seen much of this one, but these are all just variations, and you're adding carbons, you're adding oxygens, you're just slightly changing the compound so it can get through your system. Okay, so ideally anabolic steroids plus resistance training and protein, and you've got a whole bunch of muscle. Now they have been found, and this is controversial, to alter mood and cause psychiatric dysfunction. Some of these people it's much worse than, and some of these people are perfectly fine. So there's a bit of a stigma with that, but it does happen, and you can totally see it. Roid rage is the typical example. So now think about it. What sports would we use anabolic steroids in, and why? If we know they gain muscle, what sports need muscle? But not too much, right? So think about the justification. So go ahead and just kind of think about that. Pause this if you want to ponder for a second. I'm actually not going to give you an answer so that you can continue thinking about it. And I wanted to show you a study to demonstrate just how powerful testosterone, which is an anabolic steroid, is for changing muscle mass or fat-free mass. Same thing. So with no exercise, and this study is from 1996, Bazin, New England Journal of Medicine, really big journal. The study is really popular in showing the effects of testosterone. They gave sedentary men, middle-aged, probably slightly overweight, but normal overall, testosterone for, I think it was 12 weeks. And they ended up, with no exercise, gaining 3.2 kilos of fat-free mass. So, quick conversion, that's like 7 to 8 pounds of muscle. And it's not on this graph, but they actually lost body fat too. So that's pretty amazing. Now, so the gray bars are going to be your placebo, and your blue bars are going to be testosterone. Now, if you add in resistance training over the same time period, with just a placebo, you see about a 2 kilogram increase. It's pretty typical. So 4 to 5 pound untrained people, pretty typical in the first 3 to 4 months. But when you combine it with testosterone, and this was 600 milligrams, which is quite a bit, you get 6 kilos. So that's almost 13 pounds of muscle. So that is quite a bit. And this is when people said, oh, wow, we know in the underground world that testosterone works, but now in the medical world, we can say, maybe we should be giving these to people who are muscle wasting. And this was a double-blinded study. So randomized controlled trial, a double-blinded study, so they didn't know what they were getting. So that's really important to know too. It's kind of the best study you can do. If we look at the steroid side effects, we can see they lead to a number of serious problems. Just in general, this is a general overview: high blood pressure, cardiovascular complications, so you can basically have a larger heart, kidney failure and liver damage if taken in high doses for high periods, stroke, cholesterol levels change, and then heart attacks occasionally. So pretty severe side effects. We look at men versus women. This is basically just a blanket list of everything that could be a side effect. Just because you take something doesn't mean you will get side effects, nor does it mean you'll get all of them. But you do need to know some of the side effects that occur when you take these ergogenic aids. Now the next one we're going to talk about is DHEA. And you can just call it DHEA. That's a very long name. But the idea behind this one is that it's a steroid in the pathway of, similar to testosterone, of cholesterol. So we have this cholesterol up here. It gets converted eventually to DHEA. We'll actually talk about this one next. But testosterone is interconverted here. So the idea being, if we supplement DHEA, we skip some steps, gets converted between these two things, and if we get to testosterone, I just showed you, big effect. Normally it's synthesized from cholesterol though. Now it's highly, not elevated, but it's one of the most well-expressed steroids in the body. And since it occurs naturally, this is where the FDA doesn't always get it right. They have no control over it. And for a long time, people thought that it would blunt the effects of aging, namely because of this graph on the right and this nice bottle that you can pick up at GNC or Vitamin Shop. You see a massive decrease with age, right? So ultimately, it doesn't work in most people. And by work, I mean work like anabolic steroids or testosterone, which is the goal. But it does work in some. So this is a meta-analysis. So this is where you take all of the published studies and you kind of do some stats, and you can determine what kind of effect is a drug or whatever you're measuring has. So this study found that, and you can read this right here, I won't read it to you, there was a small positive effect on fat-free mass in older adults, right? So maybe it's worth taking if you're an older adult, but again, not necessarily if you are young and healthy. Now moving on to androstenedione, pronounce it slowly and you can get it. it is also in that pathway that I showed you a couple slides ago, right? So we're supplementing here now. So we're ideally skipping even more steps. Could be better. It is found naturally. A lot of things are found naturally, and you'll often hear that athletes consume them from raw meat or something crazy. But that's pretty rare to get a positive test by consuming something. Usually they're either taking it, or their trainer is giving it to them, or they're just kind of turning a blind eye. A lot of these things will have an effect that you wouldn't notice if you were an athlete specifically. That's the main issue. So you can get it in the US. I don't think it's actually legal anymore, but this guy, Roy Jones Jr., he's a fighter, and there's a lot of pharmacological aids in, I think, fighting, cycling, and we'll say like football. It has quite a few of them because of the testing strategies. And just because you're on something doesn't mean that you're going to be A, tested for it, or B, that it'll show up on a test, or C, that you can't get around it. But in 2000, Roy Jones Jr. won the world lightweight title, or heavyweight title, sorry. But then he tested positive for androstenedione. So if this drug, which does increase muscle mass, has an effect, that's an advantage, and that's not allowed. Now, when we look at one study that I just wanted to show you guys, and it's hard to read and kind of ignore the graph over here. I don't think, if you want to look up the study, pull up the link. I do encourage you guys to do that. I put links in so you can read them. But according to manufacturer instructions, if you take 200 milligrams, it doesn't elevate testosterone. It does elevate estrogen, which for a male might be bad. So kind of keep that in mind. And that's exaggerated by resistance exercise. So it has an effect at high doses, but not at low doses. And then, as I just showed you, so we have no elevation of testosterone at low doses, no real effects here on any of these. And this one, which could be bad, elevates estrogen. Muscle protein synthesis is how you build muscle, so it doesn't really affect that. And then a lot of these drugs can impair your blood lipid profile, so you could have HDL, LDL changed. And then obviously it is a precursor to steroids, so you could be tested for it and it could show up. Okay, so next we'll go into beta-2 adrenergic agonists. So we call these beta-2s. They're popular because they help you gain muscle and reduce fat at the same time. It's a recomposition molecule. It doesn't have the side effects of steroids, like that long list, and it facilitates its mechanism, right, through epinephrine, norepinephrine, and other amines. So it's completely different, basically, mechanistically. Now, it's been used in a ton of studies. This is one of the most well-studied things that I've seen. I actually worked in a lab that did this type of stuff in rats. But beta-2 andros are clenbuterol, salbutamol. There's a couple other ones. Basically, if you've ever had an inhaler, those are beta-2s or beta-2 agonists. But they do have an effect, again, in people with diseases. So you can increase lean muscle mass and increase relative strength, right? So that's really important for those people who need it. There are side effects, of course, and it, again, has been proven in a number of different situations to work. So the negative effects. These are all from rats. I think that most of these apply to humans, and I'll walk you through them just so you can have an idea of what's happening. So this one, I don't think happens in humans, but it's worth knowing. This one, cellular deformities, is broad, but it has a cellular effect. We won't get into that. It can inhibit bone growth, so if you're like a kid, that could be bad, or a female going and you have any chance of osteoporosis. So these two also. It can change the structure of the heart, which is terrifying. And then due to the benefits of performance and whatnot, you can change the aorta size, which you generally don't want to change the size of things in your body, especially once you're an adult. And it's highly abused in physique sports. Very abused. Now, it's also abused in cycling. If you remember the 2010 Tour de France, Alberto Contador won. Later was found guilty of taking this drug. So, and his was, he actually got caught using salbutamol. But they're just slightly updated versions with less side effects. So they do work to help build muscle, reduce fat, improve performance. But again, they are pharmacological aids. Let's go on to HGH, so human growth hormone, which most people think stimulates muscle growth, but it actually stimulates bone and cartilage growth. The benefit is it slows glucose and amino acid breakdown, so maybe you wouldn't lose or break down as much muscle. But you can actually see this structurally in people who take HGH. Their facial structures will change, especially in adults, right? Not as many kids take this. It's also super duper expensive. It's $500 a dose, and you have to take it once a week. So it's very, very expensive. But it has some serious side effects that are often not used because really not many people are often not reported because people don't generally use this because it doesn't improve performance as good as some of the other drugs like beta-2 agonists or anabolic steroids. So you have gigantism and acromegaly. So you'll need to know what those are. I'm going to let you look them up, but it will be on your test. Some other side effects are swollen feet and ankles, joint pain, carpal tunnel, and diabetes in serious cases. So kind of just know what all that is. Moving on to amphetamines. They are obviously illegal, but they stimulate the nervous system. They mimic the effects of epinephrine and norepinephrine, and this increases blood pressure, heart rate, cardiac output, breathing rate, metabolism, and blood sugar. So everything goes up, right? Now the downside of everything going up is everything comes back down, and amphetamines are known for a large crash afterwards. But if you took this right before a race, for example, it would have an ergogenic effect. And on top of all that, you get reduced feelings of muscle fatigue, so you can work harder for longer. It sounds like a pretty good drug. There's the whole addiction thing, which is bad. There is kind of headache, insomnia, nausea, dizziness, and confusion. This one is not as kind of well reported, but these are definitely things that amphetamines will do. Honestly, if you want to think of it as a super caffeine, that's basically what it's doing. Because caffeine has all of these same effects. High doses for long periods, you get weight loss. If you look at drug addicts, that's fairly easy to see. Paranoia, mental effects, psychosis. So the side effects are clearly not worth it in this case. And I think that leads me to the next kind of critical thinking question, which is, which aids are worth the risk? If you had to pick one, judging from the benefits and the side effects and the risks, which I didn't give you a percentage or anything, this is something to consider. What kind of athlete are you, and what kind of benefits would you see? So just think about that for a few minutes. You can go ahead and pause it, or just we'll keep rolling. Now, caffeine. Everybody, well, not everybody, most people use caffeine of some sort, and it is the most widely abused drug in the world, right? So it is natural, so it's not technically a drug, but caffeine is found in 3 plant species. Basically, they're leaves, seeds, or fruits. The intestinal tract absorbs it pretty dang quick. If you've ever had caffeine on an empty stomach, you'll notice that it's more effective than if you have it before or after a meal. And it's well known to improve endurance performance and short-term performance too. And I put these guidelines in there because I would like you guys to think about how much caffeine you're taking. So a Starbucks cup has, I think, 150 milligrams for a grande. A diet soda or soda has about 60 milligrams. Rock Stars, your general energy drinks with the higher caffeine content have anywhere from 150 to 300. I think Red Bull has 80. But it's something that is kind of interesting to add up over time, because you do adapt to it. And I put 2 nice articles in here that you guys should check out if you are interested in learning more about caffeine. Now, what's the ergogenic effect? What's the mechanism? Right. I haven't told you many mechanisms, but this is one that's worth at least looking into. If you're going to pick caffeine for your ergogenic aid paper, definitely look into the mechanism. So it helps facilitate the use of fat as fuel. Now, this is why you see it in so many popular diet supplements. It also spares glycogen reserves. So as we talked about the ketone lecture, if you can spare glycogen, that's a good thing in general. And it acts one of 2 ways. So you can do adipose, most people have a good bit of adipose, or vascular tissues, so that's going to be your veins and arteries. And again, works through epinephrine and the adrenal medulla. Now, a good idea is to try to interpret what these graphs mean, because I think if you can do that, you can understand how caffeine works. And I will add that decaf caffeine still has a little bit of caffeine in it. Now, there are a few warnings, and I just want to touch on those kind of quickly. Similar side effects as amphetamines, like I said before, so restlessness, headache. You can actually get headaches if you don't have caffeine, if you're kind of addicted to it. But lots of problems can occur, especially if you get into the high dosages. We had a study once where someone overdosed the participants on caffeine and was off by a magnitude of 10. So instead of, I think it was 300 milligrams, they got 3,000 milligrams, which is a very large difference, and will cause all of these side effects. I think the average person, probably college students, intakes probably between 300 and 600 per day or so. I mean, depends how much you really like caffeine or what you're doing. But it does act as a diuretic, so it can be used for weight cutting, or again, it's in supplements, diet supplements. Now, there are two genetic components of caffeine. And I don't want you to remember this, and I actually won't even tell you the genetic names. But there are two variants. And if you are a fast metabolizer of caffeine, you have one. If you're a slow metabolizer, you have another. That's something else that if you're writing a paper on, then maybe you could include. Moving on to ginseng. So it's thought to, in Eastern medicine, that's supposed to say, yeah. Anyway, prolong life, strengthen sexual function, and be invigorating. Doesn't have any medical uses in the United States other than a soothing agent, so in some skin ointments. And then it comes in all forms. And the claim is that it boosts energy and diminishes stress. None of those have been true. So, not necessarily a supplement or aid that will hurt you, but one that may not give you an effect. This is one that people love to use as a placebo, and throw it in lots of different supplements and stuff to say it does something, but actually it's just more of a placebo effect. So ephedrine was banned in 2004, so it was a long time ago. It used to also be in a lot of diet pills, essentially. Amphetamine-like. And it's been used, and occasionally is still used for some basic things. We have better ideas on how to treat this stuff, and the common cold can't really treat that. More of a symptom effect. But it has central and peripheral effects. And this is Maradona, a very famous soccer player. And so this was in the 90s. He came out and he was playing not that great. He's a little bit older, and then between two of the games, his performance improved like drastically. Like he looked 10 years younger. He was all over the field. He was doing great. But it turns out that he was actually just on ephedrine for a few games. So they caught him, banned it. Wins turned into losses, and he was again banned. So not necessarily something that you want to use. I think there's not really a reason to use it anymore. Some of the side effects, so bronchodilation. This is where you get your performance effect, right? So that's good. Can also be bad long term. Increased heart rate, cardiac output, and blood pressure. High doses can cause a number of problems, and then like amphetamines and caffeine, you get these general kind of problems. Okay. So alcohol is also one of the most abused drugs by people of all age, shapes, and sizes. Some people will take alcohol before like a talk or a game or something very stressful, and it basically is a downer, so it calms you down. But taking too much, it can actually flip and be a promoter of aggression. And we've probably all seen this in life. And those things are backed by research, but it's not been shown to be ergogenic on anything of performance concern that we care about. If you, practically speaking, if you've had some alcohol and then you go try to work out, it's a lot harder, right? There's really no effects, no beneficial effects. So there are some interesting things in people looking at how alcohol affects recovery, right? So the idea that athletes, after a big game, they'll go out and they'll drink quite a bit, and what level of drinking can they do without inhibiting their recovery? That's not clear yet, but it looks like a couple drinks wouldn't hurt you, but if you're binge drinking, it would, which also makes sense. So some side effects: depression, imbalance, impairs coordination, reaction time. This is why it's illegal to drink and drive, and just be generally intoxicated in public. It does affect cardiac function, and it causes dehydration, and it's a diuretic. So that's part of the reason it causes the dehydration. So buffering solutions, the next things we'll talk about, and we're almost done with this lecture. So increased acidity in the body and the muscle inhibits energy transfer, so it causes fatigue and muscle fibers can't contract. But if you could take something to blunt that or stop it, you could have an ergogenic effect. So this, I mentioned this in my ketone lecture, and it's bicarbonate. And it's been shown to definitely improve endurance, anaerobic exercise. So think like a sprints, not resistance training at all. The only problem with it is that it causes really bad stomach issues. So it's not, nobody really takes it. But this was more of a proof of concept back in the 80s and 90s, where they were like, oh, if you take bicarbonate, it'll improve performance. And then athletes started doing it, and they realized they were in the bathroom for a long period before or after, and some of them couldn't do it at all. So not necessarily something that's used, but is and is not banned, an ergogenic aid. So glutamine, so it's a non-essential amino acid, which means your body can make it, which means you probably don't need to take it. This is one of the ones that just won't go away in terms of ergogenic effects. It has, the main problem with glutamine is it's in a lot of muscle, right? It's amino acid. And it's been shown to counteract, protein synthesis declines and muscle wasting. But that's from repeated glucocorticoid use, which is a very high stimulant of muscle protein breakdown. This is not something that you hardly ever see unless you are in surgery, like having some sort of surgery essentially. But it's basically like a stress shot into your muscle. It can modulate glucose minimally, and it does play a really important role in immune function, which I won't get into any of that. But because it's a non-essential amino acid, you can supplement other amino acids in your diet, or if you're just taking enough, you'll be okay and you don't need it. Now moving on to hormonal blood boosting. This is a big one in cycling and endurance sports, and this is where you take EPO, which is a synthetic form of erythropoietin. This is probably the biggest cycling abuse drug. And you can inject it, essentially. But it's a part of red blood cells, right? So it regulates red blood cells production. So if you have more red blood cells, you can carry more oxygen, you can perform better. That's the basic idea. But it can result in really high hematocrit levels, and which, when you get hematocrit, for lack of better words, your blood gets thick, essentially, which is really bad, as you can imagine. And now they test for this, but you can also test for hematocrit levels in humans. I have a colleague who works for the U.S. Anti-Doping Association, and they have basically now what they call a biological passport. So if you take someone's blood or urine, it goes kind of into their database over time, because a lot of athletes, especially Olympics or international level, are tested repeatedly. Goes into their system, and now they have a kind of a blueprint of your body. So if something changes drastically, they know that you're probably doing something. So that's how we're dealing with the issues of doping in sports now, and those expend, a very wide variety. Okay, so this would be a class assignment, but these are all things you're going to have to know. This is a good proof of concept. And lastly, here's my contact information. Again, Brandon Roberts. I put my socials on here if you guys want to check any of those out. I post a lot of good educational content on exercise and nutrition. If you want to look up supplements or ergogenic aids, this is a free site, probably the best site on the internet. You can look through their references and find things for your papers. So I will say definitely check this site out. This is the, again, first site. If I see something that I'm not aware of, I'm like, oh, I wonder if Examine has looked at it. And this is a group of PhDs, scientists, doctors, dietitians, everybody in the medical field. They have some great reviewers and writers, and it's all free. So with that, I'll end there. Let me guys know if you have any questions. Shoot me an email, and I'll see you next time.